I want to introduce to you a guest that we have joining us all the way from Mozambique in Africa, Charles Woodrow. Charles and Julie are missionaries that we support working in Mozambique, and they are joining us via Skype this morning. And Charles, we're glad to have you and Julie, both of you, with us online this morning. Welcome. Good morning.
Good morning to you.
I guess it's afternoon where you are, so thank you for the time displacement there. For those who aren't familiar with the work that you're doing in Mozambique, give us a little background, a little history. How long have you been there, and fill us in on the work that you're doing?
Well, we've been working with a Reformed Mission evangelical board in Mozambique for the last 30 years, and we've been involved in church planting and literature distribution ministries. Through bookstores and through reading clubs and through free distribution of books to pastors and training programs and conferences. For 20 years, we've held annual conferences for church leaders from all over Mozambique. Usually 300 to 360 pastors and church leaders attend, and training seminars in systematic theology. And we actually started out in medical missions exclusively. I came into the country as a general surgeon working in a government hospital just outside of Nampula, the second largest city in Mozambique, with a population of 1,200,000 people. So that's a snapshot of our ministry.
Tell us about COVID-19 in Mozambique. What's the status of the pandemic in Africa?
Well, it got to Mozambique on the 23rd of March, and people were expecting dire consequences. The epidemiology specialist in London had produced a paper expecting that 94% of Africa would be infected by the virus, that it would move very quickly through the country with terrible consequences because of the way people live here in the poor mud hut neighborhoods where they have just two-room mud huts with no indoor plumbing and such, and it's difficult to practice social distancing. So they expected it to be very serious, and so did we, and we still expect it to be serious in time. But because of the gravity of the arrival of the virus in Africa, the African nations have responded very promptly. When we still had only 7 cases in the entire country, they went into lockdown. They closed down all the borders and went into a loose form of lockdown in the cities, closed down any gathering of people more than 10, and closed businesses and things like that, similar to what's happening in the States. It's had a lot of economic consequences, but because they've done it so early, they have succeeded in confining the virus to just 2 locations in Mozambique. And 43 days into this epidemic, when we should have 16,000 people infected already, we've only got 80.
Wow.
But the cost is having to live in these shutdown conditions so that the virus doesn't get loose in the mud hut neighborhoods, and they can't keep that up forever. And the irony is that the entire 29 million people of Mozambique were all still susceptible. And there's virus here more than there was before. And when the restrictions are lifted, we worry about what's going to happen.
Charles, in God's providence, you've been working for many years now in finishing out a medical facility, a hospital there where you are. And the onset of COVID-19 has meant that the government officials in Mozambique have heard about your facility, come to inspect your facility. It's really brought you to the attention of the government officials. And I think we've got some pictures of the facility and of your visit with those folks as you share what's been going on there.
Yes, I actually was out of the country in the United States for 3 weeks when the virus hit Africa, and people started closing their borders. We had to rush, cut off the last 10 days of our trip and rush to get back. We got back 1 day before South Africa banned any people from the United States even setting foot in their airport. So we were able to get through South Africa and into Nampula the next to the last day that was possible. And after we were here, we really felt constrained to offer our facility to the government because we have a nice facility ready to go, not already in use because we haven't passed the inspection yet. And so that's how they came to know about us. And that prompted all these investigations very quickly on the part of the government leaders, the governor, the provincial director of health, the surgeon general for the province. All of these huge delegations of people came to check out our hospital, and they were delighted. And they were tremendously relieved because here was a hospital ready and waiting to take all these COVID patients. And so we've been designated the COVID treatment center for the city of Nampula. Again, 1,200,000 people. They'll all be sent here, those who have to be admitted because they can't survive at home.
Wow. And are you prepared for that as a staff? Or do you have the protective equipment that you need to be able to bring in people who are infected and protect yourself in the process?
We're starting from zero because the hospital wasn't built with COVID in mind. All of the drugs that have ever been shown effective in treating COVID patients in any study, none of them are available here in Mozambique. And all of the equipment we'd like to have is being siphoned off, of course, to the countries that already have the virus and have the money to purchase it. We cannot get anything. So we can't get any drugs. And I'm battling to work on just getting oxygen. Oxygen is extremely expensive. People don't appreciate this, but our hospital's been expanded so that we could handle 270 patients if need be. But the oxygen requirement for 270 COVID patients is $60,000 a day.
Wow.
And that's over $1 million in every 17 days that we would have just to help keep these people supplied with the oxygen they need to sustain life. So we're working on seeing what we can do to meet all of these problems with the obstacles that are in the way. And I have prepared a proposal that I'll be sending to the embassies tomorrow in Maputo, Western countries, to see if they can help provide the funding. We would need $1 million to meet this this problem in our hospital. And we have it all prepared out and we have it all planned. We've got the quotes and everything else. We need the financing. But we're trying to work on that. With regard to personal protective equipment, that's non-existent. Also, we're having to make everything ourselves. I've bought up all the vinyl I can get in town. I've bought up all the surgical cloth I can get. We'll have to make everything reusable. I've bought gum boots in the hardware stores and industrial grade face shields for industrial workers in the hardware stores, which we'll be using. We're making the masks, we're making the gowns, making impermeable aprons out of this vinyl material. Everything will have to be disinfected and reused day by day. A lot of work ahead of us. And so I'm very thankful that the measures taken so far have kept the virus from spreading. But again, the conditions in Mozambique haven't changed. And once the lockdown is lifted, which it'll have to be lifted eventually, our Constitution only allows 90 days of emergency measures, and then economics is another factor. But when it's lifted, the virus will get its feet and start to travel. Yeah. And so we'll have to get ready. But so we're rushing against the clock.
So this is something that's going to be with you all for the next couple of years, don't you imagine?
It depends on how well they can confine the virus. If they can't confine it, it'll pass quickly in Mozambique, the conditions that we have here. Mm-hmm. If it can be confined at great economic cost, then it'll drag out a long time. And of course, that's what they're trying to do. Of course, at the end of the day, we're all hoping that there will be a vaccine that can be administered so that the virus will be halted that way.
Charles, what about gospel opportunities that are emerging as a result of all of this?
Yeah, I certainly felt constrained to offer the hospital to the government because it's needed medically. But also realize that what can we do to help these people? I asked to be made the hospital director. They can't do that. They require that it be somebody in the chain of command of the Ministry of Health. But they have put me on the management team, and I did ask for privileges as an attending, and they gave me that. So I'll be there. And I plan to do just as I did in the government hospital 30 years ago, where we prayed with every patient that set foot in the operating room. I'll pray with everybody and witness to them, tell them the gospel. And that's the silver lining. If they can't get anything else, at least they will hear the gospel for what will be for some people the last days of their lives, and hopefully they will respond. So that's our silver lining. That's one thing I know we can offer. And thankfully, that's guaranteed because of the fact that we own the hospital.
In addition to praying for provisions for you and for safety for you, what else can we pray for?
Those are the big things, the success with the evangelism and the lives of these people, but particularly that we would be able to get the materials we need to treat them medically. Also, a protection of the people who will be working there. Our compound will be a hotbed of out of sight viral titers, and the protection is not as much as we'd like. When I spoke to one of the workers, who was going to employ just to clean the wards, we have to disinfect them every hour with Clorox. I told him it could be risky, and he said he's not a religious man at all, but he said that's okay. I'd rather die for something than live for nothing.
Wow.
And when he said that, I thought, well, man, if anybody understands what that means, it's a Christian, because we know what the something is and what the nothing is more than he does. But we need protection on the part of the workers, and then means to medically treat the patients, and then a good response to the gospel. That's what we're praying for.
Well, let me join you in those prayers, and let's all pray together here for the Woodrows and for the work there, Father.